requirement for CIC exam eligibility. We will illustrate today the old requirement and the updated points in eligibility, and we will illustrate some component of CIC exam. This is our objectives for our lecture today. By the end of this session, inshallah, you will be aware about what is the meaning of CBIC, what is the mission, vision, and history of CBIC, why you are insisted to be CIC certified and the value to be CIC certified, the domain of CIC exam and the degree for each one inside the exam, domain meaning main chapters of the CBIC, eligibility requirement for the CBIC, and how to proceed for the exam. And we will discuss together how to be certified and the methods of recertification, and we will discuss the cognitive levels and the example of CIC exam. This is the component of our session today, inshallah. First, we will start. What is the meaning of CBIC? CBIC meaning Certification Board of Infection Control and Epidemiology. It was established by ABIC in 1981. The goal for the CBIC to provide the direction and administer the certification process for infection prevention and control. This is the history of CBIC. All of us know the ABIC. ABIC meaning Association for Professionals in Infection Control and Epidemiology. In 1978, ABIC established a goal to organize or to initiate new organization. So from the ABIC, create new organization called ABIC Certification Association. ABIC Certification Association. They working together to develop process for infection professionals. They agreed together to initiate new organization, drive it from this to organization. This new organization will determine eligibility criteria and develop recertification plan for anyone want to be CIC, for anyone want to be infection control professionals. So the beginning of CBIC started in 1981, delivered from the ABIC. And by the 1982, CBIC became an independent board and responsible for infection control professionals and infection control certification. So the CBIC is voluntary multidisciplinary board that provide direction for and administer the certification process for professional in infection control and applied epidemiology. Now, CBIC is the only organization responsible for certification for infection control internationally. So the mission of the CBIC provide pathway to assess and maintain infection prevention competency between all the staff working in the infection control, and its vision, healthcare without infection through variable competency. At the start of the CBIC, they put strategic priorities for their work. We summarize these priorities as follows: maintain and improve the accredited certification program. As we see, every time CBIC make updating in the exam and the materials for study. Second priority, increase recognition, value, or certification. As we see now, most of countries and most of organizations require CIC certified professionals to work in infection control. The organization now not satisfied by the staff by experience only. They need certification for anyone working in infection control. Increase the number of certified IBC, and this will see together now how many staff now certified. Last priority, establish and maintain partnership with ABIC and APAC in Canada and other organizations to accomplish goals. This is the strategic priorities for the CBIC. Now, CIC certification is infection prevention and control, the only standardized measurement of essential knowledge, skills, and ability expected of prevention and control professionals in North America. Now, the staff of the IB professionals certified in CIC reached to 8,002 to 1. It's distributed for more than 4 countries, and the number increased year by year. What is the purpose of certification? Why you insist to be CIC certified, and why is the CBIC encourage all infection control professionals to be CIC certified? So the value of certification will be providing a standardized measurement of current basic knowledge needed for person practicing infection control. When we discuss together and through discussion of infection control questions from the CBIC, they include all types of questions, and all practice can be done by infection control professionals. Second issue, to encourage individual growth and study, promoting professionalism among infection control professionals. Formally recognize infection control professionals who fulfill the requirement of certification. As we said, most of organizations now not only require staff with experience in infection control, but also require essential certification for CIC. Well, now we will discuss what is the difference between certificate and certification. For example, if any one of us take infection control course, he will be certified and will be required by the organization to work as infection control officer or infection control director. The certificate meaning it's you have the basic or the baseline knowledge about infection control. So any course you attend, you will get certificate for this course, but this certificate doesn't mean that you are professional in infection control. But the certification, like CBIC certification, it means that you have mastery of knowledge, you have expert knowledge about infection control. This is the difference between certificate and certification. So most of our colleagues ask me about if I attend many courses, it qualify me to work as infection control. It will provide you good information, but you will be eligible to work in big institution as infection control officer or infection control professionals. So when we ask about why the CIC certification is very important, because CIC certification confirms that your study and hard work, you have an international recognition level of knowledge in infection control field. It gives you a sense of professional accomplishment. When anyone say I'm CIC certified, it's meaning that he is expert in infection control and he has professional level of knowledge and awareness about infection control standard and implementation. Also, CIC certification have many benefits, like it enhances in credibility and the prestige for anyone CIC certified. Just you pass the exam, you can put CIC certified in front of your name. Personal satisfaction that anyone certified has satisfaction, he has good and expert awareness about infection control, and he became unique in his organization. It enables you to become a part of team, which help to lower the infection inside the healthcare setting. It proves to others you are knowledgeable in the field, have good experience and good awareness. Support future knowledge and skills. Show commitment to best practice in infection prevention and control and improved patient care. Moves your profession forward. This is the benefits of CIC certification. So the CIC examination is the standardized measure of the knowledge, skill, and ability expected of experienced professional working in infection control. Just you got CIC certified, you got these benefits and this background for you. Some facts about the exam. CIC exam is valid for 5 years. Just to be CIC certified, it will be with you for 5 years. And after this 5 years, recertification is necessary. The fees for this exam is $375. The exam consists of 150 multiple choice questions. Only 135 of these questions are used for the score. The other 15 questions is for testing for new exams. So you are only this number of questions considered for success score or passing score. And until now, the passing score is if you success to solve 84 questions correct, you will be passed for CIC exam. What is the message of certification? We have two types of certification. We have initial certification. This is for the persons who first time to enter for the exam or enter the exam before and failed for first time. So they called initial certification. If you pass this certification, it will be valid for 5 years. And this after this 5 years, you have to recertify CIC. Recertification also give you validity for 5 years. Recertification can be done by two methods, and we will discuss it later in this session, inshallah. Initial exam or initial certification will be done by what called proctored exam. Proctored exam. This is administered by computer. 5 days per week, from Sunday until Thursday. And the calculation and revision for this exam done by only 5 cities all over the world. This is the site for CBIC. This is the component of our exam, of CIC exam. CIC exam include 8 domains or 8 main chapters. These domains cover all aspects of infection control, and this is the distribution for the questions. For example, each exam will contain 22 questions related to identification of infectious disease, and will contain 24 questions related to surveillance and epidemiologic investigation. Also will include 25 questions related to prevention, controlling transmission of infectious agent, and 11 questions for employee and occupational health, 13 questions for management and communication, 11 for education and research, 14 questions for environment of care, and 15 questions for cleaning, sterilization, and disinfection procedures. This is the distribution of questions inside the exam. So, as we see, all the domains are very important. We can neglect any one of them. Now we will discuss the eligibility requirement for the exam. As we know before, starting from 1st of June to 2021, there is updating of the requirement, and it will be discussed now. This is the plan of CBIC. Till last 28 May, the old exam was valid. Since 1 June, the application for the beta exam, which is called beta exam or the new exam, start. Sorry, 22 July, it's the worst time. It was the last time to take the old exam. starting from 1 August till 30 September, the testing for beta exam, the new exam, which I think will not differ more about the current exam. After 30 September and during October till January, the result of the beta exam will be distributed for the staff takes the exam. During October, November, December, there is no CIC exam. It will be as incubation period for CIC exam, and starting from January 2022, we'll start the new exam for all professionals. Okay, now we will talk about the eligibility requirement. First one of the requirement is that the staff or the person who wanted to be CIC certified, he should introduce proof of degree. You must provide diploma or transcript of this diploma. Letter will not be accepted later, and this one of the requirement. The job description. Before we can introduce any job description assigned by me, assigned by my supervisor. Now, the job description must be official job description provided on the letterhead of your employer and includes in your duties and requirement of the position must be clear in this job description. Also, this job description must be signed from your manager or supervisor and high administration. Now we will discuss eligibility. Eligibility of the exam divided in two partitions. One part related to certificate and work experience, and the other part related to activity. So eligibility related to certification. First one, you must complete post-secondary education in health related field, including but not limited to medicine, nursing, lab, technology, public health. Post-secondary include public or private university, college. First one, you have complete post-secondary education. This first one. Second requirement, you have to have direct responsibility for the infection control activity in healthcare setting. Not anyone now can introduce you CIC exam. If you don't have any responsibility in infection control team or infection control practice inside the institution, will not be able to introduce for the exam. Third one, you have to have experience in active engagement in infection prevention determined by current job description. So at least you have one year full-time employment or 2 years part-time, or at least you have 3,000 hours of infection prevention work experience earned during the last 3 years. You have to introduce or submit evidence for this one of requirements. This 3 requirement is very essential and mandatory for anyone who wants to be CIC certified. This is first part of eligibility related to certification. Another eligibility part related to the activity. Anyone want to submit for CIC exam should have good skills about these 5 domains: identification of infectious disease process, surveillance and epidemiologic investigation, preventing and controlling the transmission of infectious disease agent, environment of care, cleaning, disinfection, sterilization, and asepsis. These 5 domains of skills should be available for you to can introduce for the exam. Besides them, you at least have 2 of the 3 components: employee or occupational health, management and education and research. So from this 8 domain, you had to be expert in 7 of them. And will be illustrated in the attestation form provided by the CBIC. Also, for the eligibility of the exam, your job description, the title in your job description should be one of the following: infection preventionist, infection control link nurse, registered nurse, infection preventionist, epidemiologist, research analyst. This is the most common job titles accepted by CIC. Or the staff which related to microbiology should introduce what the evidence that they are working with infection control program. This is infograph summarize the eligibility for CIC exam. For example, if we talk about first question, do you have post-secondary degree? If no, any one of them. If no, plus it meaning you're not able to submit for the exam. If yes, you will be asked another question. Have you been employed in your current role for at least 1 year full-time or 2 years part-time? Yes or no? If no, you're not able to. If yes, go to next question. Do you perform infection prevention and control duties? If yes, go to another question. Are these duties stated in your official job description? If yes, do your stated duties include 7 out of 8 the domains, as we said previous slide? If yes, so now you are eligible for the CIC exam. And your paper will be reviewed by CIC organization, CBIC organization. And this is the processes or the steps for CIC introducing the exam. First step, review CIC eligibility requirement. If you find yourself eligible, so submit your application, supporting by the document and application fees. Third step, wait for 7 to 10 days, business days, and CBIC will review your application. If you were accepted, you will receive email for next steps, and then you will have a link. Through this link, you can determine the schedule and date and the time for your exam within the next 90 days, and you will take exam. If you, inshallah, will be successful, you will be CIC certified for next 5 years. This is the process for CIC exam. Okay, what is the document required from me when I submit for the exam? Attestation form, we will see it. This is the attestation form, new attestation form. You will review it and fulfill it and submit it from your supervisor of your head and your higher administration in the organization. Then proof of degree, CV, and official job description. This is a document required from you when submit for CIC exam. What is the meaning of recertification? As we said, anyone will be CIC certified. This certification will valid with him for 5 years. After 5 years, he will be have to recertification. This recertification may be done by 2 methods. First method, passing web-based recertification examination, like first one, like the initial certification. The same, he will book the exam and enter the exam, computer exam, or through continuing education, which is known as infection prevention units, like CME hours. It is the same, and we will discuss it now. The exam is easy, as we illustrated before. 4 IB units. What is the meaning of IB units and how we submit it? First, recertification must be submitted during the last year of certification, starting from 1 January till 30 November. and you should have the exam before 31 December. Recertifying candidates who don't pass the recertification exam must apply to recertify by the initial certification examination again. This is the SAR, Self-Achievement Recertification Examination, as we said. Questions are based on the most current CBIC, the same initial certification. So, what is the meaning of infection prevention units? As we said, to be recertified without exam, you should have a minimum of 40 infection prevention IBUs. How can I collect these IBUs? IBUs will be valid for you. If you collect any points during these 5 years, you will collect your points and you will be create account. Make account on professional portfolio starting from 1st January of the last year or certifying year. And all your document and points will be submitted before 31 October. So how I collect this IBUs? These points collected by online sessions, paper, local, national, or international conference, academic education, publication, presentation, participation in professional organization, or through teaching or researches. Any topic from them you attend or you make educator, you have evidence that you did it and submit it in the website finally. So not all topics related to ABIC will be accepted. Specific topics will be accepted. For example, any matter related to infection prevention and control fall within at least one of the 8 exam domains. If you remember, we have 8 domains for the CBIC exam. Any conference, any education sessions should I attend, it should be related to this 8 domains. If I attend any conference, any sessions outside this, will not be accepted by the CBIC. Also, specific sponsors are for accredited organization, and we will see it. Able to verify chapter member attendance or participation by providing required document. You should have evidence from this organization that prove you attend this sessions. How we calculate IBUs? It's the same like CME hours. It is the same for each 60 minutes instruction or 1 complete hour. I have 1 point. This is the resources. If you need to search more about IBUs, this is the links for CBIC IBUs. And this is the steps if you will be submit for the IBUs. First, you should have or submit or create profile on the CBIC. Start from 1 January of the recertifying year, then record activity and upload verification document. Submit the profile before 31 October. CBIC will review all this document and inshallah will be successful for this recertification. This is the steps again. Access for professional CBIC, make account website, record the activity, upload all document, submit before 31 October. This will be reviewed by the CBIC members. Beta test. What is the meaning of beta test? Beta test, which is done already nowadays. It is test for the new exam. CBIC members will try to create new domains to be introduced for the 8 domains like the AMR. So they will make some change in the domains and in the questions for these 2 months, and will evaluate this updating through the next 3 months. and will search for improvement. This improvement, if successful through the current examination, will be implemented starting from the next year, inshallah. One question may be asked: if I failed to certify in my first exam, how long should I wait to take my exam again? So if anyone failed to pass the exam, he should waiting for 3 months before submit again for the exam. So no one able to test or take the exam more than 4 times, one every 3 months. Very important point for the CBIC exam. What is the type of the exam? Many colleagues ask me, should I have save the information in my head? The exam related to case study, information, definitions. What is the type of the question? We know the domains, but what is the type of the question? CIC exam consists of 3 types of questions. Questions for recall or application or analysis, and this is a distribution of them. Recall question cover 25% of the exam. What is the meaning of recall question? This type of question tests your memory or recalling practice specific informations. This question asks about fixed information or concept or principles, like incubation periods, like infectivity period, like the name of the organism. This is what called the recall questions. What is the criteria of this microorganism? Other type from the question is called application, or what we call case study. And this is the majority of the questions. Depend on your experience, your activity. It represents about 60% of the exam. And last type is analysis. How to evaluate the data. When he give you data, how to give information about this data. And the make relationship between the parts. And this represents about 15% of the exam. So this is the types of the question in the exam. This is examples for each type. For recall questions, like, for example, in investigation, if epidemic case should be categorized according to, this is fixed information. So I call this information from my memory and apply and answer it. So any epidemic should be determined or categorized according to time, place, and the person. So the answer will be A. This for this first type of the question. Second type, which is application. The length of the stay of the patient with nosocomial infection are 12, 12, 13, 13, 13. What is the median length of stay? So I use this data for my answer. How to calculate the data. Collect them and divide the total, the sum on the count, and give the mean. Last type, analysis. When he give information, how you analyze it. The risk of healthcare associated urinary tract infection in spinal cord injury patient is best reduced by what? Intermittent catheterization. This is examples for each type. Very important keywords in the exam, like but, except, most, best. This is very critical words because it may be changes the purpose of the question. So you have to concentrate very well in every word in the question. And finally, inshallah, you will be certified for 5 years after pass the exam. This is some websites if you want to revise anything. Thank you so much. I hope it will be valuable for you and can use it for passing the exam, inshallah. I want to